I'm training for an event and it's a massive time commitment. And honestly, I've been falling behind on that over the last few weeks because of the business and battling an illness. So when I do have time to train, I need to focus on that. And then there's patient care. When I'm with a patient, I'm fully present. I'm not checking my phone. I'm not thinking about, social media posts or content calendars. And I'm definitely not starting my training for the day until all my clinical tasks are done. I'm fully present and that's where I need to be. So I need someone who can work on their own timeline, make good decisions independently, and just keep things moving forward, even when I'm not immediately available. Ideally, someone with an entrepreneurial spirit who can be trusted to handle their part while I handle mine. Welcome to Data Driven Health RX. I'm Miguel Rosa. I'm a nurse practitioner entrepreneur, endurance athlete, founder of a small integrative health practice called Blue Zone Health and Wellness, and I'm someone who believes that your health data should work for you. So on this podcast, we're diving into wearable health tech, metabolic health, hormonal health, performance and longevity, and I'm going to be sharing a behind-the-scenes look at what it's like to build a cash-based practice while balancing a clinical career and training for a major triathlon event. Whether you're a patient, athlete, or a fellow healthcare provider, or just someone who wants to feel their best, stick around. This might be for you. Important topic of discussion before we dive in. Everything shared on this podcast is for educational and informational purposes only. It's not a substitute for professional medical advice, diagnosis, or treatment. As a nurse practitioner, my role here is to solely act as an educator, not your personal healthcare provider. Accessing this content does not create a patient-provider relationship between you, me, or Blue Zone Health and Wellness. Always consult with your personal healthcare provider for any medical decisions or before starting any treatments. Let's get to it. Hey guys, welcome back. It's Miguel again with the Data Driven Health RX podcast. And today we're going to talk about something that I'm pretty excited about. I just posted my first job posting for Blue Zone Health and Wellness. I'm calling it a social media content creator and brand support role. Basically, it's a part-time contractor role. It's going to be about 10 hours per month, give or take, to start. And today I just wanted to give you a little bit of a behind-the-scenes look at why I'm making this move and what's been happening as I've been building this practice over the last year. So I'm just going to walk you through what I tried first, what I learned from that, and what I'm actually looking for in this hire. So if you're a patient or you've been thinking about coming into the clinic, this is basically a window for you to get to know what's been happening on my end, a little behind the scenes look, and just the real stuff that doesn't really show up on social media. So let's get into it. So here's what running a solo practice actually looks like. I'm the clinician. I'm seeing patients, managing their treatment plans, ordering labs, reviewing the labs. That's all the stuff that I love. That's what I went to school for. But I'm also managing the operation side, handling the finances, and we're getting into tax season. So getting ready for that, coordinating with vendors and troubleshooting my EMR when I have problems, sending in, tickets, and I'm writing newsletters and trying to plan for content and trying to build some sort of social media presence so that people know that I exist. And on top of that, I'm trying to train for an Ironman event in July. So I use Asana. It's a task management service to keep myself organized. And recently the AI said something like, you're overextending yourself. You need to reassess your deadlines. This is not realistic. And when I read that, I was just like, yeah, no shit. But that's when I realized I can either keep trying to do it all myself, or maybe I can just make smarter choices. So that's where I'm at now. But this isn't the first time that I've tried to solve this problem. Last year, at the end of last year, I actually tried to make this work a different way. I had two people who were willing to help me. Amazing people, by the way. People that I still love and respect, and thought, okay, let's try a barter arrangement, right? You help me with this, I'll help you with that. And at the end of the day, it just didn't work out, And it's not because they weren't willing or capable. They absolutely were. It was just the structure wasn't there. The deadlines and the clear expectations and the accountability that was all kind of unclear, and it wasn't really fair to either of us. So I learned something really important from that. If you need something done on a timeline, you need to pay for it. You need contracts, you need that professionalism in order to keep your business operating professionally, even if it's with people that you actually care about. So this time, I'm doing it right. There's a job posting, there's a clear scope, at least I hope it's clear. There's an hourly rate, there's expectations in writing, there will be goals attached, So, but now here's the reality. I'm early stage, I don't have a massive patient panel yet. Not that I want a massive patient panel, but I would like to grow a bit. So there's this tension between I need help to grow, but I wasn't really sure if I could justify bringing someone on when I'm still building. But here's how I'm thinking about it. If I can't keep up with the marketing because I'm too busy managing everything else, then I'm not going to be reaching the people who need to know that I exist. And if people don't know that the clinic exists, then I won't grow. So this isn't just really about offloading tasks. It's about making sure that the right things actually happen, that the content brings people in, the social media presence, the consistency that makes people remember that I'm here. So I'm bringing someone on for 10 hours a month to start, roughly, give or take. It's the right move for where I'm at, and it means that things that matter will actually get done. So here's what I'm hiring for: someone to handle social media content creation, repurposing of these podcasts and my newsletters so that they can be used in other formats on social media without having to recreate the wheel. Editing some short form video, planning an actual content calendar and not just, on a whim. Basically, all the marketing and content work. I can manage the operations for now. I can handle the clinical side, but I can't also be the content creator, the social media manager, the video editor, and still have time that I need for patient care, especially as I grow and bring on more patients in a model that requires, more one-on-one time. So this hire is about putting my time where it matters most in my day. So if you're a patient or someone thinking about working with me, here's what this actually means for you. I guess hopefully more consistent content on social media, which means better communication and honestly an easier way to figure out what I actually offer without having to dig through my website or read through the newsletters or even listen to these podcasts. Because I didn't even want to be on social media in the first place. My original plan was to focus on the newsletter, build something slower and more intentional. But the reality is that will probably take years to even get to a level where it makes sense. And not everyone reads their emails. I'm guilty. I don't even want to tell you how many unread emails I have right now. It's embarrassing. But most people spend their time on social media. That's where they're discovering new topics, learning about health topics, deciding on who they want to work with. So if I'm not showing up there consistently, then I'm basically invisible to a lot of people who might actually benefit from what I do. So potential patients will get information on my services and what I'm able to offer where they're actually spending their time, which is Facebook, Instagram, YouTube, wherever. It makes it easier for them to see what Blue Zone Health and Wellness is about, what I'm about, what I focus on, and whether it's a good fit. What I'm actually looking for in this person: someone who's self-directed and comfortable working by themselves, independently. Someone who can take a project, figure out the best way to execute it, and get it done without needing constant check-ins. This is an independent contractor role, and that's intentional. I need someone who can manage their own workflow and deliver what we agree to without having to oversee every step. And the reason that this matters is because I genuinely don't have the bandwidth to micromanage. I'm training for an event and it's a massive time commitment. And honestly, I've been falling behind on that over the last few weeks because of the business and battling an illness. So when I do have time to train, I need to focus on that. And then there's patient care. When I'm with a patient, I'm fully present. I'm not checking my phone. I'm not thinking about, social media posts or content calendars. And I'm definitely not starting my training for the day until all my clinical tasks are done. I'm fully present and that's where I need to be. So I need someone who can work on their own timeline, make good decisions independently, and just keep things moving forward, even when I'm not immediately available. Ideally, someone with an entrepreneurial spirit who can be trusted to handle their part while I handle mine. So that's what makes this role work for a solo practice, for my solo practice. If I have to manage the person handling the marketing, then I'm not really freeing up my time. I'm just shifting where that time goes. And there's value in doing as much as you can on your own when you're just starting out. You learn the business inside and out, right? You build it. But at a certain point, trying to do everything yourself just stops being productive. So this hire is about recognizing that and making a move that actually helps the practice grow. So I've already gotten some really impressive leads, by the way, on Indeed, and I'm really excited to connect with them. This is the next phase for Blue Zone Health and Wellness. It means some more consistent content, better communication with you guys, hopefully more information for you guys, and more time for me to focus on what I'm actually here to do, which is help people optimize their health. If you know anyone who might be a good fit for this role, feel free to share it with them. I'll have the link to the job posting on my blog at bluezonehw.com. If you've been following along, thanks for being part of this. If you're new here, welcome. I'll see you next time.